thank my colleague from North Dakota, both colleagues from North Dakota, here on the floor, and appreciate his leadership as a former governor and understanding of these issues like health care, which do profoundly impact the people that we all represent in the Dakotas. And some unique challenges, obviously, of meeting the health care needs of people in our state, because we have big geography, lots of wide open space. We don't have the big population centers that are in other places in the country, and so healthcare delivery and coverage of healthcare insurance and access to it are enormously important to the people that we all represent. And Madam President, I would say that it has become abundantly clear that the American people are rejecting Obamacare, which is the law that was passed several years ago here in the United States Senate and United States House, signed into law by the President. And I remember being here at the time and voting on that on Christmas Eve. We were actually here, it was December the 24th, 4 years ago, I think now, 2009. And we were right up here till the end, and this was, I would say, jammed through the United States Senate. The majority had the votes. They weren't all that concerned about having participation or input from those of us who serve in the other party, and as a consequence of that, just shoved this thing through really right on Christmas Eve. And I think that was an unfortunate way in which to conduct the business of the Senate, to enact major legislation. It's very rare around here that legislation of that consequence, that literally impacts 1/6 of the American economy, is shoved through on a partisan party line basis. And so that's the way it was done. And we said at the time, many of us were down here on the floor over and over and over again predicting that because of the way that this was structured, it was going to lead to higher insurance premiums, that it was going to lead to fewer jobs in our economy, a lot of stress on employers who are trying to create those jobs. And all of that is coming to fruition as we hear now reports day after day after day across this country from my state of South Dakota, other states across the country, from people who are feeling the very real and harmful impacts of the Obamacare legislation, both in terms of higher premiums, also canceled coverages, higher deductibles, things that affect the pocketbooks of millions of Americans, and issues that are discussed and debated at kitchen tables, but they're profoundly important to the economic well-being of people in this country. And when you're seeing the dramatic increases in premiums, the dramatic increases in deductibles, the loss of coverage, the canceled coverages that we're seeing across the country right now, it is very disturbing to people, and that's why I think you have seen this widespread rejection of Obamacare. Interestingly enough, yesterday, Health and Human Services released new enrollment numbers for the exchanges for October and November. Over the course of those 2 months, in my state of South Dakota, just 372 South Dakotans, or less than 0.5% of my state's residents, signed up for health care on the exchanges. 10 other states also had fewer than 1,000 people sign up. Oregon, which embraced Obamacare very early on, had just 44 enrollments. Think about that, 44 enrollments to show for 2 months, thanks to their website, which suffered an even more catastrophic failure than the federal website. In all, there were 364,682 enrolled in the exchanges during the months of October and November, not even a quarter of the number the administration had projected after 2 months. To meet its goal of 3.3 million signups by December the 31st, the administration would have to sign up almost 3 million people in the next 3 weeks, or more than 145,000 every single day. Now, considering that the administration has averaged fewer than 6,000 enrollments a day over the past 2 months, I wouldn't want to put a lot of money on them being able to meet that goal. It's obvious from the sluggish enrollment numbers that the American people are rejecting Obamacare. But if anyone needs more proof, 3 new polls came out last week, all reporting strong opposition to the law among the American people. The Pew Research Center poll reports that 54% of the American people disapprove of the President's health care law. According to Pew's most recent survey, the percentage of Americans who think the health care law has, and I quote, had a negative effect on the country, rose 11% just since September of this year. The Wall Street Journal NBC News poll released yesterday, the president's disapproval rating reached an all-time high of 54%. When asked what issue shaped their view of the president this year, 60% cited Obamacare. The same Wall Street Journal poll also found the number of Americans who think the president's health care law was a bad idea reaching an all-time high. Quinnipiac University also released a poll yesterday which found that 57% of the American people oppose Obamacare. The president's health care law has never enjoyed strong popular support. But Democrats and the president argued that public support for the law shouldn't be judged until the law's benefits were in effect. Well, the law is now in effect. People can buy insurance on the exchanges, yet opposition to the law isn't declining. It's the opposite that's happening. It's actually rising. Opposition to the law is increasing over time as more and more people become aware of the impacts on their personal economic well-being. Quinnipiac reported a 10-point jump in opposition to the law between October 1st of this year and December 11th. Meanwhile, support for the law, already low, dropped a further 6 points over the same time period. Now, even worse for the president, it's not just Republicans and independents who are fleeing the president's signature law. Most of the president's strongest supporters, those who initially supported his health care law and helped reelect him last year, are deserting the president. The Pew Research Center found a 10-point drop in support among African Americans since September and a 9-point drop in support among Hispanic Americans, both groups who strongly supported the president in the last election. The Wall Street Journal NBC News poll also found that, and I quote, faith in Mr. Obama has dropped noticeably in recent months among young voters and Hispanics, two groups that had been among his steadfast supporters, end quote. So the question, I guess, Madam President, is why are the American people and even the president's strongest supporters rejecting Obamacare? Why, now that the law is mostly in effect, is opposition growing rather than declining? Well, I think the answer is very simple. It's because the law has failed to deliver on the president's promises. From rising premiums to canceled health plans to lost doctors, Obamacare is doing the exact opposite of what the president promised that it would do. The president said his new law would reduce the cost of health care. And in fact, he claimed families would see their premiums fall by an average of $2,500 a year. But that promise fell apart almost immediately after Obamacare was enacted. In fact, what we're seeing out there is the average family has seen its health care premiums rise by more than $2,500 since the law's passage. And now that the law is being implemented, those numbers are only going higher. Those families who are lucky enough to keep their plans have been receiving insurance renewal notices with staggering premium increases. Premiums are doubling or even tripling for many families, and deductibles are increasing as well. Imagine getting a $600 a month increase in premiums. That's $7,200 a year. Now, how on earth is a working family, a middle-class family in this country, supposed to be able to afford that? The president would like you to believe that these Americans' updated, more expensive health plans are far superior to what they had before. But in fact, many of these plans were as good or better than what these families are getting now. Many of these plans are falling short of people's expectations because they've got higher deductibles. And of course, with all the mandated coverages that are in many of these plans, there are all kinds of things that people who are subscribing, trying to get on the exchanges, are finding that they don't need. I've had people in my state of South Dakota who are in their 50s and 60s who are asking, why do we need to have things like maternity coverage? And you see that as these letters and emails and phone calls come into your office and people are finding out about the specifics, the particulars, the details, if you will, of these various plans. They're rejecting them because not only are they creating higher premiums, but they're also plans that are not sufficient or adequate to what they are currently experiencing with the plans that they had before. Now, thousands of families around the country are going to be struggling to pay huge premium increases without receiving any additional benefit. And the situation is no better on the exchanges. While there are certainly plans with low premiums on the exchanges, many of these plans have deductibles that are so high that barring some catastrophic illness or injury, the family might as well not have insurance at all. A family without insurance who typically pays $8,000 a year in health care costs may see no benefit at all from an insurance plan with a $12,000 deductible. In fact, they may spend more on health care because now they have to pay high insurance premiums as well. So you got higher insurance premiums, higher deductibles, meaning in many cases they're not going to reach the threshold that would trigger a payment from their plan, and so they're getting no additional benefit, but they're paying way more for the same or worse coverage. So in addition to promising a new era of affordable health care, the President also promised that nothing would change for people who already liked the health care that they have. And he repeated many, many times, we've all seen the videos of this, that if you like your health care plan, you can keep it. And he even went on so far as to say you can keep it, period, to make it even more emphatic. If you like your doctors, you can keep your doctor, period. But Americans are now finding out that that wasn't even close to being true. Millions of Americans have seen the health care plans that they like canceled by insurance companies in response to new Obamacare regulations. So far, more than 5 million Americans have lost their health care plans as a direct result of Obamacare. In fact, to date, millions more Americans have lost health care than have gained it under the President's signature law. Millions of Americans are also realizing that they can't keep their doctors or their hospitals. Obamacare put in place scores of new regulations on insurance companies and the plans that they offer. To meet all of the Obamacare requirements while still getting their plans approved, insurance companies have been forced to drastically shrink their networks of doctors and hospitals. As a consequence, many families are finding that their new health care plans force them to give up doctors they've been seeing literally for years. That may not sound so terrible to some of us if we don't have a close relationship with our doctors. But what if you're a cancer patient who relies on your network of doctors and oncologists to coordinate your life-saving care? More than one cancer patient has spoken openly in the press about the struggle to find a replacement health care plan after having their original plan canceled as a result of Obamacare. The plan that covers all the doctors and the medicines that they're currently using. Joan Carrizo, a nurse from Michigan and a cancer patient, published a heartbreaking column on CNBC yesterday, updating readers on her struggles to find a health care plan that covers all of her care. I'll let her words speak for her and the other Americans in her position. I quote, "I can't begin to describe how devastated I am," she writes. "Many people like me who are in a difficult health crisis and fighting to regain good health are finding it very difficult, if not impossible, to make sure that we keep our doctors and receive the chemotherapy and other treatments and medicines that are keeping us alive. I'm scared and wondering what surprises are around the corner," end quote. Well, Ms. Carrizo brings up another thing people may lose under Obamacare, besides their doctors and their health care plans, and that's their medications. Forbes published an article this week outlining the reasons that Obamacare may cause millions of Americans to lose access to the medications that they're currently taking. The author points out that many exchange plans have steep cost-sharing requirements for prescription drugs. Purchasing a bronze plan, for example, the article points out, means that you will likely be responsible for 40% of a drug's cost. Now, that may not be so bad if we're talking about a common antibiotic, but that gets very, very expensive when we're talking about more sophisticated drugs like cancer drugs and other life-saving treatments. The second reason patients may lose access to their medications, according to Forbes, is that some plans simply may not cover the prescription drugs that the person's been taking. Out-of-pocket limits, the article notes, don't apply if the drug you're taking is not on your new insurance company's approved list of drugs. You may find yourself paying for a very expensive drug without any benefit at all from your new insurance plan. In addition to higher costs and the loss of their doctors and health care plans, there's another reason that Americans are rejecting Obamacare. Obamacare isn't just bad for health care. It is bad for the economy. New health care regulations are discouraging businesses from hiring and expanding their businesses. A CBS News article earlier this week reported, and I quote, nearly half of U.S. companies said that they're reluctant to hire full-time employees because of the law. Let me repeat that. Nearly half of U.S. companies said that they're reluctant to hire full-time employees because of the law. The Hill reported on a recent survey by the National Association of Manufacturers that found that 77% of manufacturers cite soaring health care costs as the biggest issues facing their business. The title of the Washington Post article on the health law's impact on small businesses says it all. Health care laws, aggregation rules pose a compliance nightmare for small businesses. Healthcare laws, aggregation rules pose a compliance nightmare for small businesses. That's the headline of the Washington Post. Small businesses are responsible for a majority of the job creation in this country, and if you look at some states around the country, my state of South Dakota being a good example, most of the jobs, huge majority, proportion of the jobs created in states like mine are created by small businesses. But the healthcare law is discouraging them from hiring, drowning them in regulations and promising stiff new requirements if they have 50 or more employees. And I can't tell you, Madam President, how many times when I'm traveling in my state of South Dakota, or for that matter, traveling outside my state, but specifically in my state of South Dakota, that I don't run in, when I'm talking to businesses, to people who are creating jobs, investors, the uncertainty associated with this healthcare law and the new cost because of its mandates and its requirements is making it more difficult and more expensive for them to create jobs. And so what are we seeing as a result of that? We're seeing a slower, much more sluggish economy, chronic high unemployment, fewer jobs, particularly for people who are coming out of college. Younger Americans in particular are paying a dear, dear price because of the slow economy. And when businesses don't hire, the economy suffers. And every American who spent weeks, months, or years struggling to find a job suffers too. And I know my Democrat colleagues here in the Senate know all of this. That's why some of them are starting to run away from Obamacare too. Democrats in Congress may have supported the law, but now that they have seen how it looks in reality, some of them, particularly those running for re-election, are eager to distance themselves from it. No one running for re-election wants to be too closely associated with a law that is raising Americans' health care costs, taking away their health care choices, and hurting an already struggling economy. Madam President, the American people have spoken. They don't like Obamacare. They don't want Obamacare. They can't afford Obamacare. It is time for Democrats in Congress to start listening. Madam President, I always think that it's never too late to do the right thing. And I hope that as more Americans start to weigh in and start to engage in the discussion about how this is impacting them personally, that will have such a profound impact on members of Congress here in Washington, D.C., that they will come to the conclusion that many of us reached a long, long time ago. And that is that this is a bad, flawed bill built upon a faulty foundation that is destined to fail, and that the best thing that we can do is pull it out by the roots and start over in a way that makes sense for the American people, that addresses the challenges that we have in our health care system in America today, but does it in a way that doesn't require the government to take over literally 1/6 of the American economy and create political control, command and control from here in Washington, D.C. over literally 1/6 of the American economy. 1 out of every $6 in our economy today is spent on health care. Think about that. There are very few areas where you can say that complete, total government intervention impacts that big of a swath of our economy. Unfortunately, government intervention is impacting way too much of our economy, and as a consequence of that, we're paying a price in the form of fewer jobs, chronic high unemployment, and a slower, sluggish, anemic economy, which is making it more difficult for people to find jobs and more difficult for us to get ourselves out of what is a very, very difficult economy. But my hope would be that before this is all said and done, and I don't know when this happens, hopefully sooner rather than later, because I think the sooner we make that adjustment and decide that this was the wrong course and reverse course and go in a different direction, the less damage we will do to people's livelihoods, to their personal economic circumstances, the less damage we'll do to the overall economy in this country. And so I hope that that realization comes sooner rather than later. But I think what will drive it, and I've maintained all along that ultimately the only thing that can really change this is the American people. Because clearly you have a President of the United States for whom this is his signature achievement, and unless he starts hearing from the American people, he's unlikely to change. We have a lot of people here in the United States Senate, every Democrat here today that was here in 2009 voted for this. Not a single Republican who was here in 2009 voted for it. That's probably one of the reasons I think that this is such a failed policy. It didn't have input or buy-in from the other side. You didn't get some of the best ideas coming to the forefront. There was a much, much better way to do this. And many of us who've been around here for very long have been proposing solutions to address health care challenges in this country that have been rejected by Democrats here in Congress. We've talked a lot over the years about allowing people to buy insurance across state lines. Why wouldn't you create interstate competition? Competition in a free market economy generally, as a matter of principle and a matter of practice, drives down price. And so if you create more competition, give people more choices, that tends to drive down prices. That's a fairly basic economic principle. Why wouldn't you allow small businesses to join larger groups where they can get the benefit of group purchasing power and thereby put downward pressure on the cost of health care in this country? Why wouldn't you allow for expanded opportunities for people to take care of their own health care circumstances by allowing for expanded, larger health savings accounts, opportunities for people to put money aside in an account, perhaps buy a catastrophic policy with a high deductible, but tax-free, can put money aside that allows them to cover some of those health care costs that don't reach that catastrophic level. How about finally doing something to reduce the cost of defensive medicine, which means we would have to reform our medical malpractice laws in this country and weed out a lot of the junk lawsuits that clog up our legal system and make it so much more expensive to deliver health care. I talk to physicians all the time for whom concern about liability is a major issue. It creates overutilization. You take all this great technology that we have in America today, you have physicians who are worried about being sued. Of course they're going to probably run duplicative tests, or probably hospitals, anybody who's involved in the delivery of health care in this country knows very well about the cost of practicing defensive medicine. There have been lots of studies on it done, all of which conclude that it adds significantly to the cost of delivering health care in this country. There are differences of opinion about how much that is, but there's no question that it's a factor in the high cost of health care. There have been proposals. We have a number of my colleagues on this side of the aisle who have suggested allowing people to have their own personal refundable tax credit for the purchase of health insurance, and to create equity between the tax treatment of health care that people can get through their employer with that they would be able to get in the individual marketplace. But again, the principle is greater choice, greater competition, and therefore lower prices. It's a fairly straightforward and simple, I think, formula when it comes to a market-based approach to how we deal with the healthcare crisis that we have in this country. Now, clearly, we've got programs like Medicare and Medicaid where the government is fairly heavily involved in the delivery of healthcare in this country, and that, too, is an area where we need to be looking at how can we reform and make those programs work more efficiently, more effectively, in a way that hopefully maximizes the return that the taxpayers get on those particular programs. And so if you look at programs like Medicare, there was a good example a few years ago, Medicare Part D, which is the only program I think of since I've been here, or for that matter, since I've been following policies that have been put in place over time, that actually has cost less than what it was projected to cost. Why? Why? Because it allowed for competition. It created a private component where private insurance companies would bid for the business of senior citizens across this country when it comes to their medications. And as a consequence of that, you have seen those costs come down to a reasonable level, and it actually has cost less than what was anticipated. That is a principle that we could start to apply in other areas. There are a number of things that can be done to reduce the cost of delivery of health care when it comes to the component of it that government is heavily involved with. But the point, very simply, Madam President, is that whenever you create more choices, when you create more competition, it has a downward impact on costs. It drives costs down. And so why weren't a lot of these things considered or incorporated into Obamacare when it was passed? Well, we all know the answer to that. It's because the majority party who had the votes decided to do it their way. They decided to go their own way, and we ended up, as a consequence, with a bill, a piece of legislation, and now a huge new program that has been an utter disaster. And I think any objective observer would come to that conclusion based upon the rollout of the website and everything subsequent to that impacts costs, that impacts people's ability to keep the plans that they have and the doctor that they have, that impacts the economy, which is overburdened with the cost of regulation in the new law, as well as the many, and I say many, taxes that were included in the new law. And there were lots of new taxes included, not to mention lots of cuts to Medicare, which, interestingly enough, were double counted. They were allowed to be used as quote, savings put into the Medicare trust fund, therefore extending the lifespan of Medicare. At the same time, that was going to be spent on the new health care proposal. Only in Washington, D.C. could you get away with an accounting convention that would allow you to double count revenue, which is essentially what happened. And we raised that question many times, and eventually we had a letter from the Congressional Budget Office that said, yes, this is double counting revenue. You are spending the same money twice. And yet the majority party had the votes. And around here, it's a function of math. If you have the votes, you can do pretty much whatever you wanted, and that is what they did. And we are paying a dear, dear price for that, but the people who are really paying the biggest price are the American people who are seeing these increased premium costs, increased deductibles, fewer jobs, slower economy, and lower take-home pay. I mean, that's the bottom line. If you want to really boil this down into basic economic terms, what we're talking about here is a slower, more sluggish, anemic economy, chronic high unemployment, and lower take-home pay for middle-class Americans. In fact, if you look at average household income, which is something that you use as a metric to measure people's overall economic situations, the average household income in this country since 2009, when the president took office, has decreased by about $3,700 per family. So, you know, there are a lot of things obviously that contribute to that, but I don't think it's any surprise that when you drive up the cost of something that everybody needs in this country, and by that I mean health care, in the form of higher premiums and higher deductibles, it's inevitable that you're going to see a lot of people's household incomes impacted by that. And then you couple and layer on top of that the impact that it has on the economy when you have a sluggish economy creating fewer jobs out there. That too has a very devastating impact on people's personal economic circumstances and livelihood. And so average household income since the president took office has gone down by about $3,700. Lower take-home pay, another of the results and the outcomes and the ultimate impacts, if you will, of policies created here in Washington, D.C. that make it more expensive and more difficult to create jobs in this country. So anyway, as I said earlier, Madam President, I think ultimately what gets us to where we really can change this, change course, change direction, take this thing which is headed for the cliff and turn it around and move it the other direction is going to be the American people. And I can tell you that if every United States Senator, every member of Congress, if the White House is hearing what I'm hearing from people in South Dakota, perhaps there's some hope that we can persuade enough people around here that we've got to change the direction that we're headed. And I want to just share a few things from people that I have heard from in my state of South Dakota. I had a male constituent from Sioux Falls, South Dakota, who wrote and said, "I just received notice that our health insurance will go up almost 60% due to the Affordable Care Act, or Obamacare, from $718 per month to $1,146 per month. We will also lose our prescription drug benefits and office copay benefits until each of us reaches a $5,000 deductible." He goes on to say, "We have maternity benefits now and pediatric, dental, and vision care, although I am 64 and my wife is 59. This will cost us an additional $5,000 per year." Well, you know, for somebody who is trying to make ends meet in this country, trying to get the mortgage paid, trying to put a little aside for the kids' education, $5,000 is real money. That is a tangible impact of this law on the economic circumstances, the standard of living, the quality of life that this particular couple is experiencing in America today. I have another letter. It says, Obamacare, I'm sorry, this actually goes on. I should say this is a continuation of that letter. It says, "Obamacare is sticking hardworking Americans with higher costs for unnecessary coverage. Families were denied the ability to keep their plans, the plans that best fit their needs, lifestyles, and budgets." This is a letter we got from a female constituent from Wilmot, South Dakota. She said, "My husband and I have 4 small children and purchase our own health care. My husband runs his own small business, and I'm privileged to stay at home. We are very healthy, so we have always purchased a plan with a large deductible so we can afford a reasonable premium. Today we received our letter from our health insurance provider letting us know that next month our premium will be jumping 232%. 232% increase in premium. That's over $500 more a month, and we barely use our health insurance. We currently live in an 1,800 square foot house and have been trying to find something bigger. This jump in our monthly health care premium could prevent us from being able to afford any kind of monthly house payment." Madam President, Obamacare is cutting into the carefully planned budgets of American families, holding them back from the futures for which they have carefully budgeted. Now, this is, again, as an example of a family that's trying to get by, 4 small kids, buy their own health care in the individual marketplace. Husband is self-employed, runs his own business, and a mom who's been able to stay home and care for those 4 kids. And they work very hard at staying healthy. Very, very rarely use their health insurance policy, who are going to see a 232% increase, over $500 more a month, and live in an 1,800 square foot house that they had hoped to be able to find something a little bit bigger and aren't going to be able to because of the consequences of Obamacare. This is from a female constituent in Spencer, South Dakota, and she writes, "Thanks to Obamacare, my monthly premium will increase over 100%, which equals 45% of my monthly income. My daughter lost her insurance as well. The Affordable Care Act is not affordable. And if I could tell the President so, I would. My private insurance did change. Madam President, the Obama administration has broken its promise that Americans that wanted to keep their plans could. And we are also learning that this law simply isn't affordable for many middle-class families like this lady from Spencer, South Dakota, that the Obama administration said that it would protect. When they said, if you like your plan, you can keep it, period. A lot of Americans took that to the bank. Well, clearly they should have known better. And the double talk coming out of Washington, D.C. is now not only frustrating a lot of Americans, it is creating a cynicism and a lack of trust and confidence that is going to make it difficult to do big things in the future. This is from a male constituent in Rapid City, South Dakota, who wrote, I know you did not vote for this, thank you, but I wanted to tell you, my health care premium went from $640 a month to $1,080 a month. My deductible went from $3,600 to $5,000. I feel like the federal government has stolen over $5,000 a year from me. Madam President, Americans feel betrayed by this law, likening the increased rates to theft by their own government. I mean, that's the level of frustration that people across this country are feeling. They're frustrated, they are discouraged, they are despondent, and they want something to give. They want something to change. They know that we can't continue down this path and expect that any of these families are going to be able to provide a better standard of living and a better quality of life for their children and grandchildren. $400 increase, over $400 increase in monthly premium, and a $1,400 increase in their deductible. That's the effect for this constituent from Rapid City, South Dakota. I had a constituent family from Watertown, South Dakota, who writes this, you need to know how Obamacare is harming my life and health care. We were one of the families that lost their health care plan. We heard President Obama say, if you like your health care, you can keep it. That was a lie. Our new health care plan is going to cost our family $21,600 a year compared to the health care plan of 2013, which cost us $7,335.96. That is a 300+ % increase. We're a healthy family of 6 people. We are outraged and upset. Madam President, these letters and calls to my office echo similar complaints from American families back home in my state of South Dakota and all across the country. Obamacare is costing this family more money and denying them the plan that they want. That is the real-life, real-world impact. I mean, this is really pretty, if you think about it, pretty staggering. New health care plans going to cost a family over $21,000 a year compared to $7,335 today. A 300+% increase for a healthy family of six. You can't blame them when they say that they're upset and outraged. Who wouldn't be? Who wouldn't be? This is from a small business owner from Brookings, South Dakota, who writes, in the mail today was a letter from my health care insurance provider. And well, guess what? Thanks to the great Obamacare plan, my monthly premium almost doubled and my deductible doubled. I'm a small business owner. I'd like to hire an employee next spring. Well, that's not going to happen. When will those we elect to Washington ever do something to help people and small businesses? Well, Madam President, Obamacare is not only slamming individuals, but it's hitting the small businesses, the job creators that Washington needs to be protecting. Obamacare is stopping employers from expanding their workforces. And again, you know, in a bigger place, in a big city, this may not have the domino effect, the ripple effect that it does. But in a small state like South Dakota, when you have a small business owner like this gentleman from Brookings, South Dakota, who wants to expand his business, wants to hire another employee, and says that's not going to happen. And the reason it's not going to happen is because of this huge increase in their monthly premiums, almost doubling the monthly premium and doubling the deductible. I don't know how you, if you're an employer today in this country who is trying to grow their business, expand their business, and provide for themselves and their families, perhaps put a little bit aside that they can use for their college or the kids' college education, or perhaps put a little aside for retirement, how you deal with the doubling of one of your probably biggest costs of doing business is cost of health care. You double your premiums, you double your deductible. This is from a mother in Garrettson, South Dakota, who writes, "Next year, our insurance is changing, and I will lose my family practice doctor of 22 years. The doctor that delivered all my children and that's cared for our teenage children all their lives. We'll also lose all the backup doctors our family has seen when we couldn't see our regular doctor. I was happy with my insurance, and now I have to lose my doctor." Madam President, this is another testimony of people that are losing their plans and doctors, which the Obama administration, President Obama himself, repeatedly, over and over and over again, told the American people they could keep. Families are losing their trusted doctors. So whether it's a doctor, hospital, prescription drug coverage, all these real-life examples, real-world examples of the impacts of Obamacare point to just one thing, and that is this law, one, doesn't work, and two, can't be fixed. There's no way that you're going to be able to address what most people care about when it comes to their health care, and that's the cost. When you are requiring the people who provide that health care coverage to deal with more mandates, more requirements, higher taxes, all of which are going to get passed on. All of which are going to get passed on and paid for by the very people in this country who are just trying to make ends meet and make a living and provide for their families. Those are 7 examples from my state of South Dakota. I could go on because there are many more examples. There are examples from people all across the country, but I think the point, Madam President, that needs to be made here and can't be made often enough is that these are real-world economic impacts that are affecting everyday Americans in a way that is making it more difficult for them, making their economic circumstances more complicated and more difficult. And what, if anything, should we here in Washington take away from that? Well, I think, first off, as I said earlier, that this doesn't work. Let's start over. Let's do this the right way. And it's not too late to do that. It's never too late to do the right thing. We could, if we decided to pull this thing out by the roots and start over, come up with a whole series of reforms that would move us in a step-by-step direction toward the ultimate goal, and that is to address the health care challenges that we face in America today, namely, again, which is cost. I mean, I don't think there's anybody, any American family, any individual who, as they think about having to purchase health care, if you're a young, healthy person, obviously you don't want to pay a lot for it because you're probably not going to use it a lot. And those are the people that are going to get hit the hardest. I mean, I can't tell you how somebody, if you're in your 20s, how much more you're going to have to pay to get health care coverage in this country, simply because the law requires that what they call the community rating band be narrowed so that people who are healthier and younger are going to pay much, much more to cover people who are less healthy. And that's a reality in the legislation, and it's a reality now in terms of the way that it's being applied and the way it's being implemented. So you're looking at a lot of people in this country, younger Americans and Americans of all ages for that matter, but for sure, younger Americans who are looking at higher costs because of these regulations and mandates and requirements that are being imposed upon the insurance companies, healthcare providers in this country. And you know, the new taxes, which I mentioned a little bit earlier, are also something that ultimately gets passed on. When we were debating this, the Democrats, as they argued, they would say, well, it's going to be $500 billion in tax increases and $500 billion in Medicare cuts. That's how this is going to be financed. Well, it turns out that when it's fully implemented, the cost is much, much higher, because what they did is they front-end loaded some of the revenues, back-end loaded the costs. And so when we score things here in Washington, D.C., the Congressional Budget Office looked at it and said in the 10-year window it's going to be about $1 trillion cost. Well, when it's fully implemented and you see the full impact of the cost and the revenues together, the 10-year cost is more like $2.5 trillion. So it was a massive expansion of the federal government, the largest expansion of the government literally in 50 years. And again, literally a takeover of 1/6 of the American economy. That's what healthcare represents in this country. And so if you think about that in those terms, how much this thing is going to cost, and at the time everybody said, well, don't worry, it's all paid for, it's not going to add to the deficit. We're finding out now, more and more information comes to light, more and more analysis being done, that in fact it is going to cost way more than what was initially expected. I think that we've touched, this is the tip of the iceberg. The tip of the iceberg in terms of the cost to the American taxpayers of this, financed again by higher taxes, all of which get passed on to the very people in this country that this is supposed to help. And you know, the Medicare cuts that were proposed to help pay for this, many of us said at the time that cutting hospitals, cutting home health agencies, cutting nursing homes, cutting hospices, which is what this did. I mean, this was all designed, you know, to take $500 billion, and again, when it's fully implemented, it wasn't $500 billion, it's $1 trillion when you look at the full 10-year implementation. Out of Medicare was, one, going to help pay for all the new benefits that would happen under Obamacare, and two, somehow, don't ask me how, be credited to the Medicare Trust Fund, thereby extending the life of Medicare. Again, how do you do that? How do you, with a straight face, say that we're going to take, let's just use the conservative number that was used by the Democrats on the floor, $500 billion out of Medicare, use it to finance a new entitlement benefit, but somehow be able to say we're going to credit the Medicare Trust Fund and that this is actually going to prolong the lifespan of Medicare. I mean, it was absolutely stunning at the time that we were having this debate when we raised these issues, and people would say, well, CBO says this, CBO says this. Well, because CBO uses some pretty strange accounting conventions that aren't used anywhere else in the world. Here in Washington, D.C., I mean, any place else in the world, you'd be in jail for doing something like that, for double counting revenue, spending the same money twice. But that is essentially what happened. And many of us, as I said at the time, raised this issue on the floor, tried to point out that we're spending the same money twice, and at that time it fell on deaf ears. But again, that to me is a symptom of a process that is geared to get a result with a majority vote driven through here, jammed through here, forced through here on Christmas Eve. We all had that vote Christmas Eve morning. And all I can say is, as someone who was here and observed that entire process, tried our best to warn the American people about what was going to happen, it is too bad that we didn't at the time decide, like we usually do when we do major legislation that has enormous consequence for the American people, to do it in a bipartisan way that incorporates the best ideas of both sides of the aisle and perhaps gets a big bipartisan vote. You know, usually when you pass major legislation around here, you're sort of hoping for 70 to 75 votes, perhaps even more, because you have the buy-in. Everybody's been involved in helping shape and formulate that legislation. But that wasn't the case when this passed. And again, I understand this. It becomes a function of math. You have the votes or you don't. That's the way this place operates. But you know, at that particular time, 60 votes was something that the majority had the luxury of, and didn't seem to care a whole lot about what Republicans had to say. And the president was bent on getting his initiative through and getting it his way. And that today is the reason, in my view at least, that we are where we are with a piece of legislation, the impacts of which are now being fully felt by the American people. And their conclusion is what I think their conclusion should be: this is a really raw deal. And I can't tell you, as I think about in the broader context, beyond just the world and the space of healthcare when it comes to public policy, how these decisions that are made here, major policy decisions, impact the broader economy. There is no question, there is no debate about the impact that this is having on the economy if you talk to any small business person in this country. Anybody who has the responsibility of providing health insurance for their employees has a responsibility for hiring and employing people and hopefully paying them a living wage and benefits that go with it. There is no question that this is having a detrimental impact on the overall economy, which continues to sputter along at 1% to 2% growth rate. The best thing that we could do is, if you want to really help the American people and really improve the standard of living and the quality of life for people in this country, is, you know, get people unemployed back to work, but secondly, get the economy expanding at a faster rate. And we are growing at 1% to 2% a year, and instead of 3% to 4%, that has a profound difference in not only the number of jobs that are created, but also the wealth that's created in your country. And when you think about an economy that's growing at 3% to 4% versus an economy that's growing at 1% to 2%, the difference in your gross domestic product, the difference in your total economic output is substantial. In fact, it's dramatic. Well, what does that mean? Well, it means a lot of things, not the least of which is that government revenues are a lot lower than they otherwise would be. If you had a faster, more robust economy growing at a faster rate, people were working, people were investing, people were making money, and people were paying taxes. You know, we have this debate around here like it occurs in some sort of vacuum, a static environment, that somehow, you know, Republicans come in here, those of us who believe in limited government, we ought to do what we can to make government more efficient and have it cost less. Democrats believe that we ought to have more revenues, more taxes. The problem isn't that we spend too much, it's that we tax too little. Well, that's a fundamental philosophical debate that we have here on a regular basis. And one of the reasons why, by the way, it is so hard to reach any kind of a significant budget agreement. There is a profound difference in the way that we view the world and how we get our country on a more sustainable fiscal path. Those of us who believe in spending reforms, lower spending, more limited role for the government, think that's what we ought to be doing. Democrats, by and large, believe that, you know, if we just get a little more tax revenue, if we just raise taxes a little bit more, we could do more things here in Washington, more things for the American people. Well, I happen to be of the view that the American people could do just fine for themselves if you'd allow them to keep more of what they earn. But the reality is that there is a third way, and that is to grow the economy. You can reduce spending, you can raise taxes. We ought to reduce spending. We ought to reform spending in a way that changes this fiscal trajectory that we're on today, which becomes increasingly problematic the farther you get down the road into the future. But we also ought to be looking at, in addition to reducing spending and reforming our spending programs in this country, about growing the economy and actually making the pie bigger, because that is a surefire way, a certain way of getting the kind of growth in your economy that would allow federal revenues to go up rather than down. And we've seen this over time, historically. If you look at history, history is any sort of guide. You go back to the 20s under Coolidge, or to the 60s under Kennedy, a Democrat president who understood the importance of reducing marginal income tax rates, or Reagan in the 1980s, or more recently in this last decade with President George W. Bush. When you reduce taxes on income and investment, you don't get less revenue, you get more. because it changes the behavior of the American people. People have an incentive then to invest, to go to work. That generates not less revenue but more, and puts us in a situation where we are much better off, not only in terms of our economy and the opportunities that it provides the American people, but also to the fiscal track that we're on as a nation. Madam President, I see my colleague from Kentucky is here, and would be happy to hand off to him. I know he's got some observations on, I think, this issue, Obamacare, the economy generally, other matters before us, but certainly one of the reasons that we're here is because we've got this rush to approve all these nominees to these very agencies of government, many agencies which are guilty of the very overreach that has contributed to where we are with regard to Obamacare. We've got too many regulatory agencies that have way too much power and are circumventing the will, in many cases, of the Congress to accomplish an agenda that's very contrary to the very things that I just talked about, which are economic growth and job creation. But I'd be happy to, Madam President, through the chair, yield the floor, and I think the senator from Kentucky, Senator Paul, is here to take up the mantle.